Hey everyone, let's talk a little bit more about central sensitization, a really key component to what I feel some of my chronic patients do explain, and something that I explore with a lot of them to see if there's any aspects that we can potentially be looking at to put into place. So let's jump straight into it. Peripheral sensitization is a proposed phenomenon that involves hypersensitivity of the central nervous system. It was first described in 1983. Now, we know that neuroplasticity plays a huge role in cellular changes, with an increase in both membrane excitability and synaptic efficacy exhibited. But where does that leave central sensitization? So let's start with a definition, because central sensitization is defined as an increased responsiveness of the nociceptors in the central nervous system to either normal or sub-threshold afferent input. Now, that results in hypersensitivity to the stimuli, responsiveness to non-noxious stimuli, and an increased pain response evoked by stimuli outside the area of injury, an expanded receptive field. So let's take a look at this further and start pulling it together, because there are four main areas that are important to note. Now, these are amplified responses, lower pain threshold, persistent pain, and neuropathic changes. So let's start with that amplified response, because the nervous system exaggerates the response to stimuli, even the non-painful ones. Now, with that lower pain threshold, we get increased sensitivity to pain, leading to pain with that minor stimuli. And then we talk more about persistent pain, the prolonged pain signals, even after the initial injury or stimuli is removed. And that all can lead to neuroplastic changes, so the alterations in the nerve pathways, enhancing pain transmission and perception. Now let's have a little bit of a look at this video by Judith Hunter, because it's titled Expanded Receptive Fields After Sensitization. And really what this does is it goes through a really great amount of detail, and is something that I just think is fantastic and very much worth sharing with you. So let's jump into it.
Here we have three nociceptive neurons, or primary afferents. These neurons would be in the peripheral nerve. Each neuron has a receptive field from which it transduces nociceptive stimuli into nerve impulses and transmits the information to the dorsal horn of the spinal cord, where it synapses on a second-order neuron or projection neuron. The receptive field of the second-order neuron, pictured here in yellow, is the sum of the receptive fields of all those neurons that most strongly influence it. The receptive fields are the body locations that, when stimulated, activate each specific neuron, pictured here for each neuron and for the second-order neuron. Now let's add a second dorsal horn neuron and the primary afferents that transmit the information from its receptive field. Again, those receptive fields would be specific for each primary afferent and each second-order neuron, again reflecting the body area. This is how we localize stimuli. Your patient can accurately locate a painful stimulus in normal circumstances. However, afferents always branch and send collaterals to other neurons on which they normally have little influence because of the locations of their synaptic boutons. However, when the second-order neuron becomes sensitized, these distal influences now have more effect on the second-order neuron and effectively expand the receptive field of that second-order neuron. Now your patient feels pain over a larger area, and it is less specifically localized. This is a characteristic of central sensitization.
And I think this is such a great video in that it really goes through everything that we're wanting to look at. Why is that happening? How is it happening at a neuron level? And it makes a lot of sense when we do see that. Now, the effect of this process is the recruitment of those additional sub-threshold synaptic inputs to the nociception, resulting in that greater field of receptivity, as we just saw. The increased output of nociception, so we're going to then experience potentially more pain, and the effects of this process may persist beyond the duration of that initial noxious input, resulting in pain hypersensitivity to normal innocuous stimuli. Think of a breeze, light touch. Now, it's thought to play a role in affecting pain facilitation and inhibition, inhibiting descending pathways, overactivation of the ascending, and pain facilitatory pathways as well. Now, the difference with this compared to peripheral sensitization is that central sensitization amplifies the signal with lower pain thresholds, whilst peripheral sensitization increases the sensitivity of the peripheral nerves. Now, symptoms and associated conditions can vary, but they do include some of those that we're more commonly seeing, including fibromyalgia, osteoarthritis or any of the inflammatory arthritis, musculoskeletal conditions that exhibit generalized pain, hypersensitivity, post-surgery or iatrogenic causes, irritable bowel syndrome, chronic fatigue syndrome, endometriosis, neck or back injury, migraines and tension headaches, post-motor vehicle accident injury, and post-cancer pain as well. Now that's quite a few. And when we start to put a few of these together, we can start to see some of those patients that may be more likely are experiencing some central sensitization. So where does this fit into our clinical practice? Now, they are patients with multiple inflammatory health conditions, increased stress, depression, and they fit that clinical picture where pain sensitization is present. And during these aspects, there's some really nice ways that we can go, okay, let's have a bit of a further look at this. One of those is the central sensitization inventory, which I'll go through later on during our courses here. But, really start thinking, okay, is there aspects of this that we can potentially influence and change, and bringing that right back to that biopsychosocial model of pain so that we can start doing so, absolutely. But today, that's been central sensitization. Hope I've given you a bit more information about that. Please leave any comments and we'll get back to you on those as well. Cheers.